So while the baby's breastfeeding, what is a normal sound they should be making?
Hopefully you'll hear the sound of a swallow. We know that audible swallowing is a marker for successful, happy breastfeeding, and that's going to sound like a soft k noise. You may not hear swallowing as clearly as the feed goes on or towards the length of a feed once the fattier milk starts to arrive, and that's okay. Babies make other noises, gurgles and the occasional grunt. That can be normal too. Sometimes you might hear a clicking noise. That can sometimes indicate that there's a problem with positioning and attachment and the baby's losing the seal. It could also sometimes be the sign of a tongue tie. It can also sometimes be a baby coping with really fast flow. If your baby is clicking, but you're comfortable and their weight gain and their nappies are okay, that's not necessarily a cause for concern, but get some extra help if you are worried.
What do I do if I don't have enough milk?
The truth is that the majority of people who are worried that they don't have enough milk do have enough milk, and they're just not confident about how normal babies behave and what newborn baby behaviour looks like. If you are worried you don't have enough milk, talk to someone about your situation, like your local peer supporter, breastfeeding counsellor, health visitor or midwife. If your baby has good weight gain, as we would expect, and nappies are good, they are getting enough milk. They may not just be feeding in the pattern that you expected them to. But if we do have signs that your baby may not be getting the milk that they need, there are some things that we want to look at. We want to check that your baby's positioned effectively at the breast, so they have a good latch, so they're able to transfer milk effectively. We want to make sure that you're feeding frequently enough, so your breasts are getting the stimulation they need and the baby's getting the milk they need. We want to make sure that you're not timing your baby at the breast, taking them off after a certain number of minutes, or just restricting them to one breast. You may also find it useful to use breast compressions towards the end of a feed to compress your breast to increase the amount of fatty milk that they get. In some cases, your breastfeeding supporter might talk to you about other ways to increase your milk supply, such as expressing or using a breast pump. In some cases, we may be talking about needing to supplement a baby and give them small amounts of extra milk to give them a bit more strength to help develop their breastfeeding and protect their breastfeeding. Every individual situation is different. The vast majority of people with the right support will be able to make enough milk for their babies.
So, how does being induced affect breastfeeding?
Lots of people are induced and go on to breastfeed successfully. It may mean that you're more likely to have certain interventions in your birth, like a forceps delivery, and sometimes that can mean you need extra support in the early days. The key thing is to have that skin to skin with your baby, to have the support to help your baby be latched on effectively and remove milk effectively, but it really shouldn't be a barrier to successful breastfeeding.
My question is, if I wanted to breastfeed, should I be avoiding using dummies?
Ideally, we are our baby's dummies because the breast is meant to be for comfort as well as for nutrition. We do know that when people use dummies, they are less likely to continue to breastfeed for longer. We're not quite sure why that is. It might be because the baby's having their needs met at the dummy, they don't ask to come to the breast as often, so the mum's milk supply is not able to develop. Some people think that a dummy is an essential for a baby, but that really isn't the case. Some premature babies are given dummies in the early days to help them develop their sucking technique, but it really isn't necessary for a breastfed baby to have a dummy. We want you really to be the one that meets their needs for comfort. If you do feel you want to introduce a dummy for your baby, it's probably a good idea to wait a few weeks to allow breastfeeding to become established.
Yesterday, nothing was coming out my left breast at all. And I've got like these weird bumps inside my breast and my underarm.
It sounds like you might have a blocked milk duct. Our breast tissue does go up into our underarm, so sometimes we'll find lumps and bumps in that area too when we have blocked ducts. If you do have a blocked duct, it can mean that there's inflammation in the breast, which makes it harder for you to have a letdown reflex and for the ducts to widen and allow milk to flow. We want to make sure that you're feeding effectively with good quality positioning and attachment, so your baby's going to give you the best chance of removing milk. If really nothing's happening, cool compresses might help. So that's something like a frozen bag of peas wrapped in a towel on the breast for a few moments. You might also want to use gentle massage, no stronger than if you were stroking a cat. Some people also do take drugs like ibuprofen, and you can look on the Breastfeeding Network website for more information about taking medications while you're breastfeeding. The key thing is you need to get support and not to struggle alone. If things aren't getting easier or if you start to feel unwell, do contact your GP for support.
One part of the question is, can you wean off the nipple shield? And two, what can be done to try and wean off the nipple shield?
Yes, you absolutely can wean off using a nipple shield. And most people who do start to use nipple shields don't continue using them for the whole time that they're breastfeeding. It may depend a little bit on the reasons why you started to use a shield in the first place. It might be that you need some additional help with your baby's positioning and attachment. If your baby has been accustomed to using a nipple shield, they may be used to that extra pressure of something firm against the roof of their mouth. So with a soft or flatter nipple, they may find it a little bit more difficult, and you might need help with something like breast shaping to be able to get that nipple in contact with the roof of their mouth. What we sometimes suggest is that you start a feed with a shield and then whip it off partway through, and sometimes your baby is more likely to accept feeding without the shield. Some babies are more likely to accept the breast without the shield when they're more relaxed, perhaps not so desperately hungry, and you'll need to experiment with trying at different times of the day. The key thing is don't put too much pressure on yourself. If your baby's feeding effectively and getting milk with the shield, that's brilliant news. Give them a little bit of time if you're trying to take the shield away, and do come to breastfeeding support groups for some extra help.
I'm breastfeeding at the moment, and what I wanted to ask was when would the best time be to start expressing using a pump?
It's going to depend a little bit on why you want to express, because there are different reasons. Some people may want to express to give their baby milk because they've got worries around weight gain or how much milk their baby's getting. But assuming everything's going well and you're just concerned about having some milk for the odd bottle, we normally suggest waiting until breastfeeding is established. So that's usually waiting a few weeks to give your baby a chance to tell your body to make the milk that they need and for your baby to practice latching on the breast itself. Sometimes around 6 weeks is the recommendation given, but if breastfeeding is going really well and you don't have any concerns, you may start a little bit sooner than that if you really need to be taking milk out with a breast pump.